Acute HIV infection, primary HIV infection or acute seroconversion syndrome, is the second stage of HIV infection. It occurs after the incubation stage, before the latency stage and the potential AIDS succeeding the latency stage. During this period, usually days to weeks post-exposure, many individuals develop an influenza or mononucleosis-like illness called acute HIV infection, the most common symptoms of which may include fever, lymphadenopathy, pharyngitis, rash, myalgia, malaise, mouth and esophageal sores, and may also include, but less commonly, headache, nausea and vomiting, rash, fatigue, ulcers in the mouth or on the genitals, enlarged liver spleen, weight loss, thrush, night sweats and diarrhea and neurological symptoms. Infected individuals may experience all, some, or none of these symptoms. The duration of symptoms varies, averaging 28 days and usually lasts at least a week. Because of the nonspecific nature of these symptoms, they are often not recognized as signs of HIV infection. Even if patients go to their doctors or a hospital, they will often be misdiagnosed as having one of the more common infectious diseases with the same symptoms. As a consequence, these primary symptoms are not used to diagnose HIV infection, as they do not develop in all cases and because many are caused by other more common diseases. However, recognizing the syndrome can be important because the patient is much more infectious during this period. The symptoms of AIDS are primarily the result of conditions that do not normally develop in individuals with healthy immune systems. Most of these conditions are opportunistic infections caused by bacteria, viruses, fungi and parasites that are normally controlled by the elements of the immune system that HIV damages. These infections affect nearly every organ system. People with AIDS also have an increased risk of developing various cancers such as Kaposi's sarcoma, cervical cancer and cancers of the immune system known as lymphomas. Additionally, people with AIDS often have systemic symptoms of infection like fevers, sweats, particularly at night, swollen glands, chills, weakness, and weight loss. The specific opportunistic infections that AIDS patients develop depend in part on the prevalence of these infections in the geographic area in which the patient lives. Pubic lice or crabs. Crabs is the common term for parasitic lice found in pubic hair of humans. Lice are visible to the naked eye in affected areas and are about the size of a pinhead. Pubic lice are a different species of lice than head lice. Pubic lice can migrate from pubic hair to other areas of the body with coarse hair such as underarms, chest, beard, and eyebrows. Causes: intimate contact with an infected person. Intercourse with an infected individual is not necessary for transmission, close or intimate contact is enough to transmit the lice. Transmission may also occur from contact with contaminated materials such as towels, bedsheets and clothing. Lice do not jump or fly, so contact is necessary. Symptoms: pinhead-sized bugs in pubic hair. Itching and burning of pubic area. Itching may spread to other areas of the body as the lice spread. Itching may intensify at night. Prolonged scratching may lead to secondary bacterial infections on areas of broken skin. Prevention: avoid contact with known infected clothing, towels, bedsheets and other textiles. Latex condom use is not sufficient for prevention since lice only require close contact to spread. Avoid intimate contact with infected individuals. Genital human papillomavirus, HPV, is one of the sexually transmitted infections, STIs, that is getting the most attention these days, probably due to the fact that the Center for Disease Control and Prevention, CDC, tells us that it is the most common STI and almost all sexually active men and women will get it at some point in their lives. Here are some facts to help you learn all you need to know about this STI. HPV is spread through skin-to-skin contact, often during vaginal and anal sex, but it can also be spread during genital-to-genital contact or oral sex. This means you can be a virgin and still contract HPV. There are 40 different types of HPV. 90% of HPV infections go away on their own within 2 years, but others can go on to cause more serious conditions such as genital warts or cervical cancer. There is an HPV screening for women, but unfortunately not for men. Men and women age 26 and under can get a vaccine that will help to protect against contracting this STI. Please subscribe to our channel and give this video thumbs up. Share this video with your friends on Facebook and Twitter. Thanks for watching.